Good day everyone, this is Garcia, a second-year nursing student from Section BSNII-WIEDENBACH. So for today's video, I'm going to perform an applying warm moist compress demonstration. For the definition, it is a warm moist local application to the body area. For an assessment, first we have to assess for circulatory compromise in the area where compress will be applied, including skin color, pulses distal to the site, evidence of edema, and the presence of sensation. Second is we have to assess the situation to determine the appropriateness for the application of heat. And then we have to confirm the physician's order for the compresses, including the solution to be used, frequency, body area to be treated, and the length of time for the application. We have to assess the vital signs, especially the respiration on debilitated patients before applying heat. To conduct heat through moist application, to produce local vasodilation, to improve tissue metabolism in an affected area, to increase circulation to the affected area, to promote comfort for an uninjured area, and to hasten suppuration and to soften exudates from a wound. For general considerations, do not apply warm compress when there is tendency to bleed because of vasodilation effect on the blood vessels. Second is to verify thin or damaged skin is more susceptible to injury from heat. No intact skin and drainage from wound is indications to wear gloves. For diabetic clients, victims of stroke, and clients with peripheral neuropathy are particularly at risk for thermal injury. Warm moist compress may either be sterile or clean depending on the area for which they are ordered. And for sterile solution, use sterile forceps to wring out gauze, so sterile precautions are indicated when the compress is applied to an open wound or to the organs such as the eye. Lastly is to consider age of patient, the body part involved, and type of treatment. Determine safe temperature of application to prevent burning. For the equipment, you need to have sterile gloves, prescribed solution, container for solution, sterile bath thermometer, and tape or ties, waterproof pad, waterproof bath blanket, and dry towel. First, we have to review the physician's order since reviewing validates correct procedure and correct patient. Next, we have to gather necessary supplies since preparation promotes efficient time management and provides an organized approach to the task. Next, we have to identify the patient to verify that the correct patient receives the right intervention. So, good day, Miss. I am your nurse for today, and my name is Garcia. Can I ask what's your name, please? Okay. Next, perform hand washing since hand washing deters the spread of microorganisms. Hygiene, always remember to wear your gloves. We have to check the temperature of the solution or the water. So this is our solution. We have to check this. temperature. By dipping your finger into it if it is for clean moist. But if you are doing the sterile procedure, you should use the sterile bath thermometer to check its temperature without contaminating the solution or the water. Next, we have to assist our client or our patient into its proper comfortable position and place the waterproof pad under the area being treated. Compress remains for several minutes and limited mobility in an uncomfortable position causes muscular stress and pad prevents the swelling of the membrane. Next, we have to expose the area covered with compress and drape the client using the bath blanket. Draping provides privacy to the patient. So this is our bath blanket. Next, we have to prepare for compress. Soak your gauze pad or your substitute in the water or solution. So for example, this is our gauze pad. And then, after soaking, we have to wring out compress using our forceps. So for example, this is our forceps. And then, we should grasp forceps by handle, keeping the tips down. And then, using forceps, use your forceps to pick up the gauze by edges. So, using this forceps down, and the tip of the forceps downward, and then get the gauze into its edge. And then, you have to keep one's forceps stable, wind the gauze dressings around the tip of the forceps. So, I will show you like this. In order to drain the solution from the gauze pad or gauze dressing. And then, when the dressing is dry, we have to unwind and paste over the affected area to be treated. So the solution of the water is hot, usually 110 degrees Fahrenheit or 43.3 degrees Celsius. After that, we have to place this gauze pad to the skin surface to be treated, and then for a few seconds, and then leave the gauze to check the skin for redness. Since skin redness indicates that the skin of the patient is burned. Change compress frequently to ensure warmth and to prevent cooling, and to maintain therapeutic benefit of compress. Keep the solution or water warm at all times during treatment, since continued exposure to moisture macerates skin. That will remove the compress when the prescribed time of the doctor is reached, and inspect the patient's skin and compressed area and dry. So inspecting the patient's skin, check the effect of the moisture on the area being treated. So after drying the compressed area, we should assist the patient into its comfortable position to ensure the patient comfort. have to do the aftercare of equipment and return it to the CSR. So after that, we'll remove our gloves and perform hand hygiene since hand hygiene deters the spread of microorganisms. For evaluation, there is an increased circulation occurs to the affected area, and there is an increased warmth occurs to area of application, suppuration progresses, and the pain is decreased with heat application. For recording and charting, first we have the record type, the location and duration of application, also note the solution and temperature. We have also to describe the condition of wound and skin before and after treatment, as well as client's response to therapy. Lastly is to report unusual findings to nurse in charge or physician. That is the coverage of our applying warm moist compress. Again, this is Mary Rose Garcia, a secondary nursing student from Section 1 in BSNII-WIEDENBACH. Thank you and God bless us all.